As we take a look at the medical condition affecting up to 77% of women in their childbearing years, a huge number. And that includes Oscar winner Lupita Nyong'o, who is sharing her experiences living with fibroids, speaking with members of Congress this week in an effort to increase research funding. So joining us now with more on fibroids is board-certified gynecologist Dr. Jessica Shepard. Dr. Shepard, it's so nice to talk to you on GMA. We always talk over on our digital channel. Great to have you with us. Let's start with what exactly are fibroids and why is talking about them so important?
Talking about them is so important. And what are fibroids? Now, this is the most common benign tumor of the pelvis. So it is very common, like you said, 77% of women have it in their reproductive years. The real trick is understanding, do you have one, how it's diagnosed, and what those symptoms may be.
And so this is a condition that disproportionately affects Black women, up to 80%, is that correct?
Yeah, when we look at the numbers, and again, that's where the research should go and why African American women are having more fibroids and more symptomatic fibroids, just like you're hearing from Lupita's story. But many women do have fibroids. But when you look at ethnicity, you're going to see a severe increase when we are talking about Black women.
Okay, and so for any woman who is watching at home, how would they even know if they have fibroids? Like, what are some of the symptoms? And why do so many women often face delays or even misdiagnosis before getting the right care?
You know, that's a great question, Janae. And here is really the caveat to it is if we have 77% or even up to 80% of women having fibroids, it really is something where we're going to wait as a physician for symptoms, which may be heavy bleeding or pain in the pelvis, but then going into imaging and really having ultrasound to be that diagnostic criteria that we're going to see the fibroids in the actual uterine muscle.
And this is so interesting because part of what makes this so insidious and many women not knowing about it is because they think a lot of these symptoms are just part of their normal cycle, right?
Yeah, this is where we really see the problem because I think in women's health, we really see that a lot of things are dismissed. And so when women come with complaints that may lead up to a diagnosis of a fibroid, many times they're dismissed, not heard, or said, that's normal and that should happen in a cycle. But the real questions that we should be asking are, is this different? Or how is it impacting your quality of life? And I think when we start to ask more of those questions, you'll start to see that the diagnosis of fibroids, especially the symptomatic ones, is really where we're going to see women who are going to be now impacted because we can treat them.
Yeah, because of the ways that it can really impact women's lives in so many different ways. Let's talk about treatment. What options are available?
Yeah. Now, we have both medical and surgical, and that's what I really want to emphasize for women who are listening today is that there are options. And so you can start with medical treatment, which can be a form of birth control or oral contraceptives, even working into medications that have been developed specifically for the symptoms of fibroids, but are not hormonal. And then we move more into the procedural or surgical options, which can be anywhere from procedures that don't really, cost you a long recovery into more of your invasive procedures such as a myomectomy, removing the fibroid from the uterine tissue and keeping the uterus intact, or hysterectomy, which is removal of the actual uterus with the fibroids.
There is so much to get into, but starting the conversation and keeping it going is all a part of that. So Dr. Jessica Shepard, thanks for being with us to do that this morning.
Thank you.